Not so long ago, cases of polio were occurring in only a few countries, Nigeria, Pakistan, and Afghanistan. And fast forward to today, it's not only still occurring there, but also in nearly a dozen other places. I asked Dr. William Schaffner to give us his assessment. He is the chair of the Department of Preventive Medicine at Vanderbilt University Medical Center.
Well, we were so close, but now I'm afraid we're slipping backwards a little bit, and the reason is social upheaval, wars, strife, movement of people, refugees, and it turns out that the vaccinators can't get to all those young children who need to be vaccinated. And so we have susceptibles, and the virus is now being introduced into new countries from those three original countries. And that's why the World Health Organization has said, you know, this is an emergent situation. We've got to do something more in order to contain the spread of polio and get us back on the track to eradication.
You mentioned those three countries. I'd like to focus on one. In places like Pakistan, we've actually seen attacks on doctors. In one of the incidents in January, attackers used 5 kilograms or 11 pounds of explosives. 7 people died. Yet the people involved with the vaccination efforts vowed to continue their work. Let's listen.
We want to send a message to the attackers that we're not scared of them. God willing, the campaign will continue. And God willing, one day, Pakistan will become polio-free.
Let me get your thoughts on their courage, but also take us inside the mindset of the attackers. Why are they doing it? And for the aid workers, why do they continue to put their lives on the line, do you think?
Well, my heart goes out to the vaccinators who want to continue, because they know what a noble purpose this is, to try to rid the world of this paralytic disease. Now, the attackers, they are, first of all, isolated people. They're very clannish. They're very tribal. They don't like any kind of government doing anything. But beyond that, let's all remember that in the hunt for Osama bin Laden, we used a vaccination campaign as a ruse, as a cover, to try to find out where Osama bin Laden was hiding. And that now has poisoned that atmosphere. They think that these vaccinators may in some way be spying on them.
You mentioned it's a noble purpose. You talk about the suspicions. There's also a push, though, against vaccines themselves. A study presented this week found even when there is a disease outbreak happening. Now, parents are no more likely to get their children vaccinated. Vaccination rates, in fact, in medically advanced countries like the United States, still below public health goals. Why do you think that is?
Well, in the United States and other developing countries, we have a paradox. The vaccination programs have been so successful. They have eliminated these vaccine-preventable diseases that used to be so common in childhood that we now have 2 generations. The mother as well as the grandmother don't remember these diseases, and now they question vaccination. It's a paradox, and some of those parents are withholding their children from vaccination or delaying vaccination, so we have more susceptible children, and these diseases can be imported into places like the United States and spread. So that's a kind of a strange result. We have to learn how to communicate better to those young parents.
Give us your view of the world. Which area of the world do you think is in the greatest need for action, would you say?
Well, the 3 areas continue to be those home countries for continuing polio. Afghanistan, where, of course, there's fighting. Pakistan, where there's social disruption. And northern Nigeria, where there's also fighting, social disruption, and on the part of some of the most conservative mullahs, still a suspicion of vaccination. So those 3 countries continue to be the great exporters of polio to surrounding countries.
Dr. William Schaffner, chair of Vanderbilt's Department of Preventive Medicine, we can't thank you enough. Thanks so much.
My pleasure.